I'm Bob Dempsey, and we are doing a short COVID update for the Department of Neurological Surgery, the UW Health, the County of Dane, the state of Wisconsin, and basically the state of the world. We're soon entering the fifth month of what we've known of the pandemic. This disease probably started 3 months prior to that. It's hard to tell. But we've been in a chronic state of crisis, which is unprecedented for about 5 months. And that's really telling because people get tired. It takes a toll. So look out for each other. Um, People are concerned about their jobs, and they should be. People are concerned about their children, and they should be. Will the schools be on or off? And what's the rationale there? Does it make sense? Um, at UW, we're concerned about a new surge of cases overwhelming the hospital. Will it happen or not? And look at the state. Right now, we're quarantined if we leave this state to go to New Jersey, New York, or Chicago down the road. Why is that? What's been happening? And so sometimes it's important to reflect on what we've been through, because I believe if you do, you can very, very reliably predict what's going to happen next. And a lot of the things when we've met, they've come true. We looked at this, we said this is going to be months. And if we work hard to flatten the curve, it's going to last longer, but we'll be safer. We cut the death rate by 2/3. We did that, but we're not done yet. And therefore, we can't be fatigued. So, it's a time when we have to look after each other. It's like the John Prine song about Hello in There. If you're concerned about people that are isolated, look after them, look after family, stay in touch, social distance, but check on each other. There's a lot of news. It's all conflicting. It seems to be repetitive, but I too believe it predicts what will happen next. The Nobel laureate Faulkner said that the past is never dead. It's never even past. It always is part of what we are and what's happening. So we talked about a lot of things. We talked about, what the virus looks like and how you'd attack it. And we'll be unveiling the next phase here at UW of a vaccine trial to these spikes that sit on the edge of it, because it might be unique. We also talked about the hope that if we could keep people safe, we'd either have a treatment, we'll talk about that, a vaccine, we'll talk about that, but we might not. We might just have to outlast it as it tries to mutate. These viruses change, sometimes become less virulent. The bubonic plague, there was no treatments in 1200. It was one of the most deadly diseases in the history of man. And yet it really decreased over a long time because of its mutations, making it less virulent. Is that even possible here? Well, there's good news, there's bad news. I choose good news because it gives hope. And what does that mean? The worldwide numbers are up, partly because we're identifying the disease and partly because it's moving into areas that did not have the disease before. But there is hope in that, because although the cases in Wisconsin, the US, which have been measured more and more carefully, are up, the virulence seems to be down. The death rates per infection and hospitalization rates per infection are nothing like we saw with that disease that was in Milan in New York. And indeed, we understand that that particular mutant variant is not as common in Wisconsin as the one that came from China and the West Coast. That may be lucky, it may be changing. And there is evidence that it's changing from a scientific standpoint, that it may be changing to something that's less virulent but more contagious, both good and bad news. What have we learned from day one is that the three principles work. Wear a mask, wash your hands, and distance, physical distance. Social distance is confusing to people. Physical distance. You're not going to get it if you're not in close contact with the virus. Bottom line. So how do we go about that? Well, we allow the scientists to do their work. Antibody screening is helpful. but giving antibodies to the people when they're first being hospitalized has cut our death rate. That's profound. Understanding that a lot of the people died, not necessarily from the virus, but their response to it, this massive immune response that some people have, was really causing a lot of the pulmonary deaths and probably other organ systems. A very basic drug, dexamethasone, which we use for swelling, same process on brains and brain tumors, works. It decreases the virulence. It keeps our hospitalization, our ICU rates down. It gives me great hope. And vaccines. The rush to vaccines is a two-edged sword. We cannot rush too quickly, or we may have something that causes too much reaction to patients to their harm. And yet we need to be accurate. It's our best tool. When we get a vaccine right, it can eliminate diseases, smallpox, etc. If we vaccinated everybody against measles, we'd eliminate that. But what to target, especially in a virus that seems to mutate? The Oxford group has targeted the unique spikes, hoping that would be unique and not mutate. And therefore, their first trial looks good. The stage 3 trial will be partially run here at UW. That's important. So good news is that. The second good news is that today the governor went ahead and mandated wearing masks in this state. Waiting for the Supreme Court to challenge, let it challenge. It's the right thing to do and say. I don't really want to be quarantined because I can't go to Chicago. That doesn't make sense. So here at UW, we're part of it. But we also understand the bad news of the science is that this is a multi-system disease. It isn't just a cough or a bad lung infection. It affects more organs. We talked about this months ago. And those organs may be the ones affected in the children or young people that are having more response. And unfortunately, if it affects the blood vessels, it affects brain, heart, and kidneys. And that's the brain fog people are having, the decreased energy from heart failure, the renal failure. And so the immune response is key here, and blocking that may be what the scientists are going to come up with next. But it's why we do not treat it cavalierly, and why UW, and to the extent Dane County, has done so well. If you look at what happened, it's abundantly clear when you look at the past, the last couple months, Wisconsin sat at very low rates. That's partially good luck, partially not traveling largely to New York and getting that strain here, and partially because we used masks, we washed our hands and the distance far more than many other parts of this country. And then when we opened the bars, it soared. The number of cases soared and continued till we began to clamp down 2 weeks ago, and you could begin to see a slight leveling of this rapid increase in everything, cases, deaths, etc. And as it has gone over the last 10 days, it has literally started to turn down. That is remarkable. That's important. It means we have control over this if we use the rules, because we're going to have to live with this disease. We're not going to basically magically cure it, at least not in this calendar year. The earliest that vaccine could be rolled out safely is probably after the new year. People will push for their own reasons or political reasons for sooner, but it won't be safe. It may not be safe and effective that early, but that's a hope. And then look at what's been done. We're trying to reopen. Why are we reopening? Reopening the hospital, reopening the economy. We must. We must find a way to live with this disease because it could be a long time. We knew, and we very forcibly were shown, that if you cut down all of society, unprecedented, people out of work, can't get food, can't get jobs, become depressed, violence takes place, wars take place, violence in the streets. It happened as if clockwork. We need to do our job. If we don't run the hospital as a hospital, our base patients with hypertension, with strokes, with kidney failure, with lumps that become malignant tumors will be disadvantaged. We cannot let that happen. So we have to reopen with sensible plans. If you like sports, you just have to contrast baseball and golf. Golf can isolate their players. They can watch them on TV. They don't need fans. It's going to go on. Baseball puts dozens of people on the field, dozens of support people, and they decided to open it up as if they would just be somewhat careful. 17 members of one team are sick now. Very questionable if they're going to be able to pull this season off, even without fans, because they need to follow the 3 rules with the players. So that's a lesson for football. If you understand the economies of these industries, which our sports are, I would predict that you're going to see football pushed to the spring so they can actually have fans in the stands, hoping the virus will be down by then. We'll see what they do. Will baseball continue the way they started? No, but they may modify to allow it to continue. We'll see. The best opening is UW, I believe, because I think schools need to reopen. Students need to be taught. They need to use the tools. That is largely online. And if they do meet in small groups, they've got a distance, they've got a mask, they've got to wash hands. It can be done. Hospitals shown that it can be done. So this plan of UW, which is very detailed, extensive testing, isolating and isolation dorms for people that turn positive and are not sick, quick care for people that are positive and sick, contact tracing. You can do that on a campus if you're dedicated to it, but you have to convince the students to follow the rules or it won't work. We'll see. I'm as anxious as you are to see. But what if we do surge? What if the hospital sees a rising and rising? We are seeing a rise, but not a dramatic, of patients. How will we handle it? We just in neurosurgery wrote the surge plan for neurosurgery, and it's been adopted by at least the surgical part of UW Health thus far as exactly that. And what we did was we divided the patients we take care of in tiers of urgency according to how important it was that we care for that problem. And we know really what can wait longer, what cannot, what must be taken care of. And then we began to say, well, if we have a surge of patients, what's going to be overwhelmed? Unlike in March, when we did not have PPE and we did not know the severity and we were all frightened, so we closed things. Now we know we must stay open and take care of hypertension, infections, lumps, new babies. We don't, the illnesses and the amounts of strokes will be tragic. So the plan will keep general care, general health care going while the ICUs are isolated. And the major tumors, etc., will keep going until and unless we see the COVID cases overwhelming the ICUs at definite tiers. So we respond according to what we do. If we're overwhelmed, as Milan was, as some parts of New York will, we'll have to deal with that. We hope not. And the reason I hope not is I think it may be mutating and we may be able to handle this if we understand that we have to isolate, and when we have sick people, we have to respond to limit its immune response if it becomes tragic. So that surge plan is one of the most important things for you to know, along with the mask mandate, which will be Saturday for the state of Wisconsin, is that there are responses, there are plans. But what we do in neurosurgery is very important. We continue it. What you do in research is very important. We continue it. We continue it safely by the rules, and we isolate our patients who are getting standard care from our patients that have COVID, and we test. So living with COVID is where we are and what we're going to do, and I'm quite confident we can do it. But we do it together. This stuff where people are us versus them, this is a manipulative ploy of weak and fearful people. Do not fall for it. We are presently, because of this tendency toward fear and violence, we are in a state of turmoil. And the turmoil is because we has brought to our attention millennia of racial injustice. We must deal with it together. We must embrace the positive. We must embrace the better spirits, the better angels that Lincoln talked about. But Faulkner, again, he challenged us. He said that not only can we predict the past from the future, but what we do is really a measure of us in an emergency. He said, dream and shoot higher. Do not bother just trying to be better than your contemporaries or the people around you, but be better than yourselves. And I really believe in that because it takes special people like the people that we have in this department, in this health system, in this county, in this world. We believe that we can overcome this. His most famous quote was when he accepted his Nobel Prize. He said, I believe that man will not merely endure, he will prevail. And that's because they care, they show up for work, they keep going. But they look at the present situation, understand our lives are changed, perhaps changed forever, but we'll be better for it if we protect the people we love. It should be everyone. I believe in you. Look after each other, wear masks, and teach that to the people around you. Wash your hands continuously and distance until such time as this is decreased, vaccinated, or mutated away. Will be different, but we'll be better for it. Thanks for all that you do.